Good evening and welcome to IHW Council's special web series on women's health. Start supporting treatment in assisted reproductive therapy. I'm Anisha Nair Thavan, and you're watching our exclusive show on women's healthcare supported by Bharat Serums and Vaccines under its public awareness initiative. From today, for the next 7 days, we are marking Infertility Week, where we will be bringing you experts on our show to help address all your issues about starting a family and why you may be facing a delay. We are currently seeing the COVID-19 second wave in our country a year after its outbreak. Now, this is just a reminder that we cannot put our guard down and we have to ensure masking, washing hands, and social distancing. This is also a reminder to put our health before anything. The arrival of the vaccine, the start of the inoculation process, and the lessons from last year have brought hope to millions who want to stay safe and start and bring about a semblance of their pre-corona days. There are many others who find themselves in despair as some of their dreams may have suffered a setback because of the many restrictions of the lockdown and the fear of COVID-19. I'm talking about couples who dream about starting their family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that affect many couples in our country. According to the Indian Society of Assisted Reproduction, infertility currently affects 10 to 14% of the Indian population. And the scenario is even worse in cities where one in every six couples is impacted. Our show today is special as we're going to discuss all aspects related to fertility and IVF treatment. Bharat Serum and Vaccines Project Start is an initiative that aims to provide support to couples beyond medicines with initiatives like microfinancing the treatment and counseling. Project Start encourages couples to stay on course for IVF treatment to achieve their goal of parenthood. Today, we will be discussing managing stress of IVF. Now, there may be many questions in your mind that are related to stress associated with infertility treatments. How do you succeed in starting your family? On our show today, we have an expert who will help answer all your questions. So if you're watching, do start typing in your queries in the comment box so that our expert can help answer them. Please welcome Dr. Neha Virk. She is gynecologist and infertility specialist, Virk Fertility Centre at Jalandhar. Welcome to the show, Dr. Neha.
Thank you, Anisha. It's a pleasure to be on your show today. Thank you so much.
So before I begin this conversation, reminder to all of you watching to type in your questions. And this is your golden opportunity to get it answered by a fertility specialist. Dr. Neha is with us. And over the next 30 minutes, we will try to take up as many questions that come from you as we can. Do like and comment with your feedback. To share this page, this special show on your wall or on your friend's wall if you think that they can benefit from the information that we share during this program. So let's begin, Dr. Neha. Now, IVF is this breakthrough technology where couples who are struggling to conceive and start a family in the natural way can have an alternative, a scientific way to have babies if you're struggling on your own, naturally. Now, the struggle itself is stressful. So, is that what is stressful, or is IVF stressful? Is the process stressful? What is the stress associated with IVF?
Okay, Anisha. So I will start this topic with the very word stress. Stress is a word which is just inevitable, right? We cannot avoid stress in our day-to-day life. We all have some or the other kind of stress we encounter in our day-to-day lives, but we can manage the stress by doing little modifications in our day-to-day life. That is what matters. Now, struggling with infertility is a challenging task in itself. There are lots and lots of pressure on a couple when they come to know that they are infertile. They get that feeling that they are sick, something is grossly abnormal with them. They start taking this as lack of self-confidence. There are family issues, there are money problems, the IVF journey is such a time consuming journey. There are environmental stress factors like this COVID pandemic is. So these things just add on to the burden. So by the time we recommend IVF to a patient, the patient is totally physically and mentally drained out, and to prepare this patient for IVF is a challenging task for us as doctors also. Otherwise, this problem will magnify during their treatment. According to the Society of Assisted Reproduction, they have rated IVF as the most stressful or any other, major life event. It is as equivalent to any stressful event in our lives. So to identify these potential stress points and how to overcome these points, this is our aim. So we will be discussing this in detail over next 30 minutes. So there are basically two aspects to it: how to prepare a patient for IVF or how to manage the stress of IVF. We have divided this in two aspects: what a patient or couple can do, and what is as a doctor what our duty is. So to all the couples listening our show today, what in my personal experience, the first point is, which is very important according to me, is to gather information. Gather information about IVF, as much information as you can gather, because knowledge is something which is antidote of all the anxiety and stress factors. The second point, what I feel is, be ready to take decisions. If you are well versed that what your body might be going in another 2 months, what all precautions you need to take, what all procedures you will be undergoing, then it's very easy. You can the journey, IVF journey becomes really stress free. So, like, I'll give you an example about decision making. Like, when I start stimulating a patient, like when I start making X of a patient, I give her injection for, like, say, 4 to 5 days. And after 5 days, when I do an ultrasonography, I come to know, oh no, that the egg quality is not good, or the eggs are not getting formed properly. Then we give option to the patient. We have to give multiple options to the patient, whether to continue in this cycle or not, whether to postpone it to next cycle, because a lot of money is involved, physical trauma of injections and hormones is involved. So as a doctor, we can just advise the patient, but ultimate decision the patient has to take. Okay, so second point is decision making power, so anticipate that. Third thing is talking to your partner. Talking to your partner is very important in this process, because the couple should be on the same page. They should have the same frequency. They should be emotionally so much bonded together, because you are going to experience a roller coaster ride over the next 2 months. So discuss in advance what are your hopes and expectations of each other. If the IVF cycle fails, there are millions of questions going on in the mind that time. Then the fourth point, according to me, is to relax your body and mind. How to relax your body and mind, Anisha? See, during this COVID pandemic, I get a lot of calls from my friends, from my patients, that Dr. Neha, you tell us to go to parks, to not to overthink, to go to spas, go to gym, but now gyms are closed, mobility is restricted. Now, how to cope up in this situation? But I do tell them that take this situation as a blessing in disguise. We are so advanced in technology these days that we can, always switch on our TVs and computers, and we can take it in a positive way. Like, start a YouTube video, just start a I recommend all my patients half an hour to 1 hour exercise per day. Let it be exercise, let it be yoga, let it be meditation, mindful meditation. And trust me, all these factors, they really help to release the toxins from your body. These things make you physically fit. You really feel, relaxed, your anxiety is relieved. So exercise, definitely exercise, yoga, meditation, these are small things. Even if we do it for half an hour to 1 hour a day. Then reading a book. Recent studies, they have shown that reading a book for about 6 minutes a day will reduce your stress and anxiety by 68%. Just 6 minutes of reading. Then another important thing, what I feel is, for us, especially for a female partner, is venting out. you need someone in your life, a close friend, maybe a close relative. You need to discuss everything in detail with that female or whosoever that person is in your life, that what you are going through, just vent it out. Don't keep your things inside. That will really help you a lot. And you know
Right.
what, Anisha, what I feel that, what I feel as females, we always take a back seat. Earlier we take care of our parents, then our in-laws. We are busy taking care of our careers, of the household work. No matter whatever we are doing, we always take a back step. One thing I tell to all my friends, my patients, that you need to take that half an hour out for yourself in a day, which is totally devoted to you. I
Mhm.
mean, just do whatever you feel like. Let it be painting, let it be listening to your music, dancing, knitting. There are so many things, you can do. Just keep yourself happy.
Mhm.
And
Certainly,
there are
Dr.
life
Neha,
stages.
yeah, if people take, if women take out that half an hour for themselves now, even later on when they are pregnant and they have a child, it will really help them in their well-being. Now, my question to you is stress somewhat overrated, or does it really impact the outcome of a cycle as well?
Yes, of course. No, it's not overrated at all. We have seen stress affecting, interfering with the results, because after all, stress is also one hormone.
Hmm.
Pregnancy, reproductive age, it's all about hormones. So even if one of your hormone is not okay, then other hormones will definitely,
Get impacted.
hamper. It's a vicious cycle. Yeah, it's all impacted. So it's not overrated. I have seen young girls of age of about 24, 25 with unexplained infertility. There is no reason for them to be infertile, but they take a lot of stress. And then they are not able to, take medicines properly. They are put on antidepressants. So all these things will have an impact on the IVF treatment, and as well as in natural pregnancy also.
All right. So stress is an important thing, and you want to eliminate it from your life if you want to succeed in starting a family.
Yes, of course.
Right. Dr. Neha, we've already started receiving a few questions, so let's start taking some of those up. So a Facebook user is asking, how do you qualify a patient for IVF? What are the stages involved? Do you start with some treatment at first, or do you jump straight to IVF?
No, no, no. So I will give you a little introduction about our center. So ours is a very renowned North India's leading IVF center. We've been practicing infertility, we're giving infertility treatment for the past 25 years. And so far, we have given almost about 25,000 healthy pregnancies, all thanks to the founder, Dr. S.P.S. Virk. It was his vision, his idea of starting, and his hard work that we are what we are today. So it's not about jumping onto the treatment. There are a lot of steps involved in selecting the patient right candidate for IVF. So as soon as the patient enters in our OPD, the first thing is taking a detailed history of the patient and counseling the patient. Then we come to know what exactly. First, we try to find out the cause of infertility. Okay, and there are many steps involved in it. First is doing a basic investigation for that patient. Basic investigation includes all the blood tests of the patient, doing hormonal profile for that patient, which include follicle stimulating hormone, her luteinizing hormone, her anti-Mullerian hormone, to check her ovarian reserve, associated illnesses. We do test for the male partner. We do a semen analysis. Then we test the tubes of the fallopian tubes of the lady needs to be tested, whether they are working or not. Then we need to do an ultrasonography so as to see whether there are associated abnormalities in the uterus like fibroids, endometriosis, adenomyosis. There are multiple reasons to it. And then once we find out the reason, that what is the problem, is the patient ovulating, is she a PCO, there are so many things to it. Then we fit the patient into IUI, or we do. Sometimes all you need is a little push. We sometimes the female, they think, oh, no, 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 Dr. Neha, we've come to you, you directly do our IVF and give us twins. To give you an example, few days back I had a young couple married for, and she was a doctor herself, She was just married for 6 months, and due to this COVID pandemic, she said, I said, what is the problem? So she told me that we're married for 6 months due to all these pressures. We don't want to try naturally. You directly do our IVF and give us twins. So it is not that easy. So there are a lot of misconceptions also about the IVF. But yes, we need to run a lot of tests and investigations to qualify a patient for IVF. We don't directly cannot jump for IVF.
All right. We also have another Facebook user asking, does IVF have long-term health effects?
So this is also a very, very, tricky question, I would like to say. So it actually depends upon the number of IVF cycles you are taking, about the number of medicines you are taking, and about your medical condition as well. If you have associated medical conditions like diabetes or hypothyroidism, there are so many, then we do not recommend the patient to take up many IVF cycles. And, so as such, there are no long term side effects to IVF. But yes, excess of everything is bad, Anisha, in a way. So I would recommend that will depend upon a particular way. It's an individual approach. We need to see a particular case, that if she's fit for 2 IVF cycles, 3 IVF cycles, or if we feel that these things can impact her long-term health, we directly abandon the procedure. So everything is individualized.
Could you tell us how do you assess if the long-term health of an individual may be affected? Are you saying the hormones could have a side effect? Is it the impact on the ovaries? How do you assess that for the X patient, too many cycles aren't going to work?
Yeah, so first thing is age of the patient, Anisha. If the patient, see, we have lot of patients who are coming to us from different parts of the world itself. So recently I got a patient who had 5 IVF failed cycles in Canada. She was 48 years old with 6 failed IVF cycles in Canada. Lot of medications she has taken. She was diabetic, she had a heart disease. So these kind of patients, I alone cannot take a decision. So we have to take multiple consultations for these kind of patients. It's a multidisciplinary approach. We need to have a consultation with the doctor of the heart. In layman language, we can say a thyroid specialist. So if all the doctors feel that yes, we can proceed with IVF in this particular case, then only we can go ahead with IVF. So there are different criteria. Weight of the patient, if the patient is excessively obese, if the weight of the patient is more than 130, 140 kgs, age of the patient, if she is more than 50 years of age, associated comorbidities. So this is how you basically assess a patient. But till now, there are no as such proven long-term side effects of IVF.
All right, so there are no documented side
Yes.
effects of IVF. We have another question from a Facebook user. The question is, can a 38-year-old with diabetes go for IVF?
Yes, of course. If her diabetes is controlled, now I need to know details of the patient. Like I always say, diabetes, she might be on diet control. She might be taking medicines for diabetes. She might be on insulin injections. Even if she's on insulin injections, that's what I'm saying. We have a different protocol for each and every kind of patient. If she's falling into that category, like she's diabetic, so we will get her all the blood investigation done. We will see her glycosylated HB reserve of 3 months prior to IVF. What's her reserve? What's her glucose reserve in her body? If it falls into a particular let's say if it is less than 6, what the cutout is, and her, in accordance to her endocrinologist, if her sugar levels are controlled, then definitely she can go in for IVF. In fact, out of 180 to 100 cycles we are doing per month, I mean, we were doing pre this COVID scenario, our 5 to 10% patients are suffering from diabetes. This is all, lifestyle dependent, Anisha. We have seriously seen a shift in the due to lifestyle. I don't know, but lot of patients, we are not getting any patient who's not having diabetes. There are a lot of associated problems along with infertility. So infertility is just one part. Diabetes, absolutely, we can make a patient pregnant if she's having diabetes.
Right, but having such an issue, metabolism-related issue, or PCO, or thyroid issues, does this impact the success rate? Perhaps that is where the question is coming from. Will it impact how successful the cycles are?
See, this will again depend upon a uh, particular case scenario. Like if this particular question, she's a 38-year-old, if her diabetes is controlled, if her AMH is good, and if we are doing the cell cycle, and once we are doing the cycle, if her eggs are good, the embryo formed are good, the lining is good, then there is no reason for a failure.
Okay.
Right.
So you're saying it's not like.
No, the scenario is if she's 38-year-old and she is diabetic, her AMH is below the cutoff limit, like her AMH is 0.2, something 0.3, and she wants to go in for self-fix cycle, then the results would be different.
So it's individualized. It's not one size fits all.
No. It's not. It will not depend upon diabetes or thyroid or some particular metabolic disorder. We have to evaluate
the whole picture.
Whole of the whole picture we need to look.
All right. Another Facebook user is asking, at 43 with 2 cysts and 2 fibroids, can a woman conceive? Now, I think she's talking about natural conception here.
So yes, at the age of 43, now I need to know the detailed history of the patient, whether this is a case of primary infertility or a secondary infertility. Has this female mentioned anything like that?
No, we don't have more details. These are all the details we have.
To see for cyst and fibroids, I definitely need to do an ultrasonography. If these are simple cysts and the fibroids are not in the endometrial lining where we have to implant the baby, then definitely this patient can conceive. If the fibroids are interfering where we have to keep the baby, then we might need to go for removal of the fibroids, myomectomy we call it. We need to treat these patients. That's what I'm saying, that IVF is just not a 2 or 3 weeks procedure. We need to prepare the body before going for IVF. Like if there are cysts, we need to treat the cyst. If there are fibroids interfering with the body, we need to treat these fibroids. And then the next thing is she's 43. We need to check her AMH as well, whether it will be a self-egg cycle or a donor egg cycle, depending upon her AMH.
Right, but at 43, would you then suggest she try naturally, or should she just go to get all the investigations done?
No. At the age of 43, after a basic evaluation, a full proof investigation, see what happens after the age of 35, Anisha. There is a high risk of genetic abnormalities in the baby. It increases, and due to current lifestyle, current use of plastics, there are so many things we cannot avoid. The food is adulterated, everything is adulterated. So the chances of genetic abnormalities in the baby, it increases with age. And at the age of 40, after the age of 40, it increases at a very faster rate. So we do not actually advise, or even if the patient gets pregnant naturally at the age of 43, then during her antenatal period, during her pregnancy, she needs to be properly evaluated for these, genetic abnormalities. Of course, we cannot say no to her.
Right. We have another question. The Facebook user is saying, I have mild PCOD and hyperthyroidism, but I'm not able to conceive naturally. Please suggest a way out.
So in polycystic ovary, the first step is lifestyle modification, Anisha. So if she is mild polycystic ovaries, if she is doing regular exercise, if she's taking good diet, healthy diet, if she is not obese, she can naturally conceive. This is the category of patient who needs just a push. I can evaluate her on ultrasonography if I see that, once we can do a trial cycle. I can examine her on day 2 or 3 of her periods, what's her basic follicular, what reserve is. Then on day 12 or day 13 of her periods, I can see whether she's naturally making an egg or not. If she's naturally making an egg, then there's no problem. Maybe within 5 to 6 months, with lifestyle modification, she will conceive. But in case if on day 12, 13, or 14, maybe if I find that her egg is not of the appropriate size, then we need to give her a little push, a little. There are these fertility enhancing medicines. We can give her 5 days, 6 days accordingly, and we can tell her the appropriate time of contact with husband, and she can conceive naturally.
All right. We have another question, and this Facebook user is asking, I'm 37 years old, suffering from primary vaginismus for 4.5 years. Is IVF or IUI my best recourse given the age factor? How should I decide?
She's suffering from vaginismus, you are saying?
Yes.
And she's 37 and trying
for 4.5 years.
So, Anisha, basically, vaginismus is one thing in which the patient is not able to have intercourse due to the fear and tightening of vaginal muscles. So, they should not waste any more time. They should get all their baseline investigations done. And if everything is all right, like I told you, we can get her evaluated, and by IUI, simple thing, she doesn't need IVF. If all her investigations fall into the normal category, maybe we can just do an IUI, simple IUI we can do, as she's not able to do natural this contact with her husband. Yes, so we can do IUI in this patient. She doesn't require IVF. But if IUI cycles fail, like 2, 3, or maybe 4 cycles of IUI fail, we can think of IVF.
All right.
Because the only problem here is not being able to make contact.
Right. Now, another question that is coming is, can physically challenged paraplegic be allowed for availing surrogacy?
Yes, these are the ideal candidates for surrogacy because, their body cannot undergo IVF procedures. And we have done cases of surrogacy for such patients. These are the ideal candidates. So in these patients, if her ovaries are okay, we can take out eggs of this female and sperms of her husband. We will make the embryos and put in a gestational carrier. We call it surrogate.
Right. But now, after the laws have changed, the surrogate has to be from within the family, right?
So these things are still under, a lot of controversies are still going on. And these kind of patients, they do get their own surrogates. Okay. Recently, we have done one case in which the patient, the lady was affected from polio. So she was paraplegic. And so some of her relative, she was the gestational carrier for her.
All right. So she had already got a donor. Right. Dr. Neha, thank you so much for answering so many questions that you've taken up during this show. I want you to leave us with your last words on managing stress. Because, this period itself is stressful. We're seeing so many depressing news. Plus, infertile couples are also stressed about their own failure of not being able to start a family. On the flip side, we have seen, the lockdown lead to more pregnancies. So what would you like to say in the last words to everybody watching?
I would just like in one word, I can say, stay happy, laugh a lot. Laughter is the best medicine. Find ways to laugh, to smile. This stress thing will go on in life. Infertility is just one part of it. Look at the broader picture. So just do things to make you laugh and smile.
All right. So bring in happy joys in your life and take everything in its flow, including
a very positive manner. Yes.
All right. Thank you so much, Dr. Neha, for joining us and answering so many questions that you have and giving us your advice on how to counter stress during the cycles of IVF as well as the infertility journey. Thank you so much for joining us.
Thank you, Anisha. My pleasure. Thank you so much.
So that was Dr. Neha answering your questions on fertility and IVF treatment during COVID-19. Now, if you have more questions, you can send them to us through WhatsApp. To use it, click on the WhatsApp button on our page and don't forget to follow us to stay updated on all that is happening and all that concerns your health and well-being. This program was supported by Bharat Serums and Vaccines under its public awareness initiative. We'll be back with our special show, and do remember, we are marking the Infertility Week starting today for the next 7 days. We'll come to you every other day with a special show with an expert on our show to help answer all your questions. Do follow us on Facebook to get all the updates on our upcoming programs. Keep sending us your questions and we'll include them in our next show. Stay at home, stay safe, take care, and have a good evening. Goodbye.